Okay, so I'm going to be doing observation and instrumentation. So for observation, I'm just going to be looking for any like scars, birthmarks, pimples, anything that would mess with the reading. So for the cervical spine, I'm going to go ahead and make sure this thing's on. Put it on medium sensitivity and keep these things narrower than I would in the thoracic spine. So I'm going to start at about T2. I'm going to just move up the spine, looking for any deviation. And if I find it, I'm going to go ahead and go over that area 3 times. Just to verify, and then I would mark underneath the nervous scope. So in the thoracic spine, I'm going to go ahead and widen these up a little bit. Same thing, except I'm going to be going down the spine, making sure to keep it tight against the skin so that I can get an accurate reading. So now I'm just going to move down the spine, looking for any deviation. And if I find one, same thing, go over it 3 times just to verify, but this time I'm going to mark above the nervous scope. Alright, so I'm Lawrence Larson. I'm going to be doing static palpation. Alright, so first thing we're going to be doing is just looking for visible edema, looking for just like any kind of swelling or bogginess or anything like that. And then so the next thing that we're going to be doing is pain on palpation. So just like if I'm going to put pressure on the inferior tip of the spine, and if they have any pain, then that's a sign. Okay, and then so for the SI joints, I'm going to go down and feel, and if they have tenderness in the upper joint, that means it's a PI. Tenderness in the lower joint, that means it's an AS. If the whole joint, it might be an EX. If there's no pain, it could be an IN. All right, now we're going to be doing motion palp on the occiput. So just go ahead and grab the occiput and then test lateral flexion on both sides. And so you're just feeling for that springy in play. And so if I don't feel the springy in play, that would be a RS, and this would be an LS. Okay, and then so now I'm going to test P to A glide. So to test the first part, I'm going to tilt it over to the right just a little bit and slide P to A. And then I would go test the left side, slide P to A. And then so the last portion, I'm just going to put my calcaneal over the forehead, pull to the side, and I'm going to test the right occiput. And I'm going to test the left occiput. Okay. All right, to finish up the motion palpation, what I'm going to go ahead and do is check the rotational aspect of the occiput. So I'm just going to put a finger on the mastoid and my other finger on C1. I'm going to go ahead and rotate their head to the opposite side. And so if I don't feel a separation on the right side between C1 and the mastoid, then it is a RP. So I'm going to do the same thing on the left side. Rotate to the right. And if I don't feel a separation, then it is an LP. Boom.
You're an LP.
Let's go. Oh, you sit your ass down.
So now I'm going to be doing motion palp for the atlas. So to start off, I'm going to put my finger between the tips of C1 and C2 TVPs. I'm going to laterally flex the patient's head to the right, and you should feel it close down, but if not, then you would add an R listing. I'm going to do the same thing. Go down on C1, C2, put my finger between the 2 TVPs. I'm going to laterally flex to the left, and again, I should feel it close down, but if I don't, then it's a L listing. All right, so now I'm going to have you stand up. All right, I'm just going to have you rock your head a couple times and stop in a neutral position. All right, so now if he stopped with his chin up, it would be an AS, and if he stopped with his chin down, it would be an AI. All right, I'm going to have you sit back down. Okay, so now I'm going to test posteriority. So I'm just going to contact the posterior lateral arch of TVP, or the posterior lateral TVP of C1. And I'm just going to rotate the patient's face away from the contact side, push P to A on the atlas, and you should feel it move. But if not, then you have a P. And I'm going to do the same thing on the left side, and if you don't feel it move away, then you have a P.
I got it. You're on.
All right, I'm going to be doing motion palpation of the spinal segment, the cervical spine. So I'm just going to find C2 and C3. I'm going to get in the inner spinous space, and I'm just going to flex the head and extend the head. So during flexion, you would expect the spinous processes to separate. So if they don't, then you have a posterior listing. So then I'm going to do rotation. And so for this, I'm just going to put my fingertips on the spinous processes, and I'm just going to rotate to the left. And you should feel them separate, kind of form a staircase. And if you don't, when you turn it to the left, then you have a left listing. And then do the same thing to the right, and you should feel the staircasing. If not, you have a right listing. So after that, we're going to test to see what side the wedge is on. So I'm just going to put 3 fingers on the side of the spinous processes, and I'm just going to have them laterally flex to the left. And then I'm going to test the other side real quick. Laterally flex to the right. And so what you're looking for is if it flattens out on either side, then that's the side of the wedge, and you can get your S or I listing. All right, so I'm going to be doing motion palpation for the SI joint. So the first thing I'm going to do is I'm going to go ahead and put my index finger on the sacrum and my SIF on the PSIS. And I'm going to grab the contralateral shoulder and rotate them back. So this should produce movement, but if it doesn't, then that'll give you your listing, either right or left, depending on what side it's on. So then next we're going to do the bend test. So I'm just going to place my thumbs on the superior margin of the PSISs and have the patient bend forward. So the side that moves up first and stays higher is the subluxated side, so that'll give you either right or left. And then if it wobbles up, then that's going to be a sacrum listing. To continue motion palpation of the SI joint, I'm going to assess glute height. And so just looking at the insertion, you're just comparing bilaterally. And so the glute that's higher is going to be an AS ilium, and the glute that's lower will be a PI ilium. So then after that, I'm going to put my thumb on the PSIS of the affected side, and I'm going to put the other thumb in the center of the sacrum. So then I'm going to have the patient raise their right knee. And so I would expect the right PSIS to come back and posterior and inferior. If not, it's an AS ilium. So I'm going to have the patient raise the opposite leg. So the thumb on the sacrum should move inferior relative to the ilium contact. So if not, it's a PI on the involved side. All right, so now we're going to be testing the EX or IN portion of the SI listing. So what we're going to do is we're going to look at glute width. And so the narrow glute is going to be an EX, and the wide glute will be an IN. So next, we're going to have the patient sit down. Okay, so we're going to put the patient on the front half of the chair, and I'm going to put a finger in the affected SI. So then I'm going to have the patient swing their leg laterally from a neutral position. And so I should feel the joint close down. If not, it's an EX. And then I'm going to have the patient bring their knee medially, and I should feel the joint open up. If not, it's a IN.